What if I told you that some of the most common medical tests your doctor is ordering for you right now could actually be doing you more harm than good? I know, that sounds impossible. You trust your doctor. You go in for your checkup. You do what you're told. You get the tests. You think you're being responsible. But here's what most people over 65 don't know, and what many doctors are quietly telling their own family members behind closed doors. Some of these routine screenings are not just unnecessary at your age. They can lead to unnecessary surgeries, dangerous complications, severe anxiety, and treatments your body simply does not need. Today, we're going to talk about all 5 of them, clearly, honestly, and with the kind of straightforward advice that every senior deserves to hear. Stay with me, because by the end of this video, you may never look at your next doctor's visit the same way again. Now, before we dive in, I want to be clear about something important. This video is not telling you to stop seeing your doctor. Please, always work with your healthcare provider. What we are doing today is giving you the tools to ask better questions, to have more informed conversations, and to make decisions that are truly right for your body and your age. Because here's the truth about medicine in America today. The medical system was largely designed around younger, healthier bodies. Many of the screening guidelines we follow, the get this test every year rules, were developed based on studies of people in their 40s and 50s. But when you're 65, 70, or 80 years old, your body is different. Your risk factors are different. And what is helpful at 45 can sometimes become harmful at 75. A growing number of honest, forward-thinking doctors, including those who specialize in care for older adults, are now openly saying, we are over-testing our senior patients, and it is causing real harm. So let's talk about the 5 tests where the evidence is clearest, and where having a deeper conversation with your doctor might be one of the best health decisions you make this year. Number 1. The PSA blood test for prostate cancer, especially for men over 70. If you're a man watching this, or if you love a man over 65, this one is especially important, so please listen closely. The PSA test, which stands for prostate-specific antigen, is a blood test that measures a protein produced by the prostate gland. For decades, it was considered a gold standard for detecting prostate cancer early in men. And on the surface, that sounds wonderful, right? Early detection saves lives. Here's the problem. The PSA test has a very high rate of what doctors call false positives. That means the test often shows an elevated number, causing serious alarm, even when there is no dangerous cancer present. In fact, many older men have slightly elevated PSA levels simply because of aging, or benign prostate enlargement, or even a urinary tract infection. But when that number comes back high, what happens next? More tests, biopsies, anxiety, sleepless nights, sometimes surgery or radiation. And here's the part that breaks my heart. The American Cancer Society, the U.S. Preventive Services Task Force, and many leading oncologists now agree. For men aged 70 and older, routine PSA screening offers very little benefit and carries significant risk. Why? Because prostate cancer in older men is often what doctors call clinically insignificant. It grows so slowly that most men will die of something else entirely, long before that prostate cancer ever causes a single symptom. But if that cancer is found through PSA testing, the cascade of interventions that follow, the biopsies, the surgeries, the radiation, can cause incontinence, complications, and a dramatically reduced quality of life. Let me paint a picture for you. A 74-year-old man goes in for his routine checkup. His PSA is slightly elevated. He has no symptoms. He feels completely fine, but now he's on a treadmill of follow-up appointments, a prostate biopsy, and ultimately a surgery that leaves him struggling for months for a cancer that would never have bothered him. This is not a hypothetical. This happens every single day in America. So what should you do? If you are a man over 70, have an honest conversation with your doctor. Ask, given my age and health history, Does PSA screening truly make sense for me? That is not a difficult question. That is a wise one. Number 2. Aggressive cholesterol screening and statin medication for adults over 80. Now, this one might surprise you, because we have been told for so long that controlling cholesterol is one of the most important things we can do for our heart. And for many people, especially those in their 40s, 50s, and 60s who have had a heart attack, that is absolutely true. Statins save lives. We know this. But here's what's happening with our oldest seniors, people aged 75, 80, 85, and beyond, that isn't talked about nearly enough. Cholesterol levels in very elderly adults don't carry the same predictive power they do in younger people. In fact, several large studies have found something that challenges everything we thought we knew. In adults over 80, low cholesterol has actually been associated with increased mortality. Not decreased, increased. Let that sink in for just a moment. Meanwhile, statins, the cholesterol-lowering medications that millions of seniors take every single day, come with a list of side effects that are particularly dangerous for older bodies. Muscle pain and weakness, which increases fall risk dramatically. Cognitive issues, memory problems, confusion, brain fog, liver stress, digestive problems, and yet many seniors are placed on statins in their 70s or 80s, and nobody ever stops to ask, does this person still need this medication? Is the benefit worth the risk at this stage of life? This is called deprescribing, and it is one of the fastest growing conversations in geriatric medicine today. Many doctors who specialize in elder care are now proactively reviewing their patients' medication lists and carefully removing drugs that may be doing more harm than good. Here's a story that might sound familiar. Margaret is 82 years old. She was put on a statin in her mid-60s after her doctor noticed her cholesterol was slightly elevated. For 17 years, she faithfully took her pill every night. But over the past few years, Margaret had been struggling, muscle weakness, occasional falls. Her family said she just didn't seem like herself. When her new doctor reviewed her medications, the statin was one of the first things they discussed. After a careful conversation, and with Margaret's full agreement, they stopped the medication. Within weeks, her muscle pain improved. Her energy came back. Her family said she seemed clearer, more like the woman they knew. That was the statin. So if you are over 75 and currently taking a statin, or if one has been recently recommended, have this conversation with your doctor. Given my age and overall health, is the benefit of this medication still greater than the risk? That is not a rebellious question. That is an empowered one, and any good doctor will respect you for asking it. I want to pause here for just a moment and speak to you directly. If you are over 60, or if you are caring for an elderly parent or loved one, the information in this video could genuinely be life-changing. Not because it tells you to distrust medicine, but because it gives you the power to be an active partner in your own healthcare, not just a passive patient who nods along. You deserve to understand what every test is for, what the real risks are, and whether it is truly right for your body at your age. If this video is helping you, please take a moment right now and hit the like button. It helps this information reach more seniors who need to hear it. And if you have a parent, a spouse, or a friend over 65, please share this with them. It might be the most important thing you do for them this year. Now let's keep going, because the next 3 tests on our list may be the most surprising of all. Number 3. Routine Pap smears and cervical cancer screening for women over 65. Ladies, this one is for you. For decades, the annual Pap smear was considered a non-negotiable part of women's health care, and for younger women, absolutely. It is a critical and life-saving screening, but here is what the American Cancer Society, the U.S. Preventive Services Task Force, and the American College of Obstetricians and Gynecologists all agree on. For women over 65 who have had adequate screening in the past, meaning normal Pap results in recent years, routine cervical cancer screening is no longer recommended. and continuing to screen can actually cause harm. Here's why. Cervical cancer develops very slowly, typically over 10 to 20 years. In women who have had consistently normal results throughout their lives, the chance of developing cervical cancer after age 65 is extremely low. But when Pap tests are continued unnecessarily, they often find minor abnormalities, changes that are common in older tissues due to hormonal shifts, not cancer, and those findings trigger follow-up procedures, biopsies, treatments, pain, anxiety, complications, all for something that was never dangerous to begin with. Now, there are important exceptions. Women who have a history of cervical cancer, women who were exposed to a medication called DES during their mother's pregnancy, or women with a weakened immune system may still need continued screening. This is exactly why the conversation with your doctor matters so much. But if you are a woman over 65, with a long history of normal Pap results, it is entirely supported by medical evidence to stop routine screening. And yet, thousands of older women continue receiving this test every year because nobody ever stopped to reassess. So ask your doctor, based on my screening history, do I still need Pap smears? If the answer is yes, ask why. You deserve to understand. Number 4. Routine cardiac stress testing for seniors without symptoms. The cardiac stress test, where you walk on a treadmill while your heart is monitored, sounds like a very sensible way for an older adult to check in on their heart. Shouldn't everyone know how their heart is performing? Here's the thing. For seniors who are not experiencing chest pain, shortness of breath, or other cardiac symptoms, and who don't have a recent history of heart disease, routine stress testing is not recommended. Not by cardiologists, not by the American Heart Association. Why not? Because the test has a significant rate of false positives in patients who feel perfectly fine. A result that looks abnormal often turns out to be nothing dangerous at all, but getting that result triggers a chain reaction. More tests, a cardiac catheterization, an invasive procedure that carries real risks, including bleeding, infection, and in rare cases, stroke or heart attack. And sometimes, unnecessary stent placements or bypass surgeries in patients who never needed them. The medical term for this is cascade harm. One unnecessary test leads to another, and another, until a perfectly stable older adult is facing a serious medical procedure they never needed. The Choosing Wisely campaign, a national initiative where medical organizations identify commonly overused tests and treatments, specifically lists routine stress testing in asymptomatic older adults as something to avoid. Let me put a human face on this. George is 78 years old. He has no chest pain. He plays golf twice a week. His doctor, during a routine visit, suggests a stress test, just to be safe. The test shows a minor abnormality. A catheterization is scheduled. During the procedure, George has a complication. He ends up in the hospital for 4 days. The original abnormality turns out to be clinically insignificant. George goes home, but now he's scared of his heart. He stops playing golf. He spends months worrying about a result that was never truly dangerous. That is the cost of one unnecessary test. So if you're feeling well, exercising without difficulty, and have no cardiac symptoms, ask your doctor, is there a specific clinical reason I need this stress test, or is it just routine? If there's no clear medical reason, it may be entirely wise to skip it. Number 5. Routine colonoscopy screening after ages 75 to 80. Now, colonoscopies are incredibly valuable. For adults between the ages of 45 and 75, regular colonoscopy screening has saved hundreds of thousands of lives by catching colon cancer early. But here is what many seniors are never told. For adults over 75, and especially those over 80, the U.S. Preventive Services Task Force no longer recommends routine colonoscopy screening, and for adults over 85, they actively recommend against it. Why? 2 important reasons. First, the preparation for a colonoscopy, the bowel cleansing process, is physically demanding, and it can be dangerous for older adults. It causes significant fluid and electrolyte imbalance, which can lead to kidney problems, heart irregularities, and serious dehydration. For a healthy 50-year-old, this is manageable. For a frail 80-year-old with kidney disease or heart problems, it can trigger a medical crisis. Second, the procedure itself requires sedation, and sedation carries elevated risk for older adults, particularly those with dementia, heart disease, or breathing difficulties. Complications are rare, but they are more common in elderly patients. And perhaps most importantly, colon cancer grows slowly. If an 80-year-old has been screened regularly throughout their life and had clean results, the chance that a dangerous new cancer will develop and progress to a life-threatening stage within their remaining years is quite low. That is not a dark statement. That is a compassionate, honest, and medically sound way of thinking about what a screening test is actually for. Now, if someone has never been screened before or has a personal history of colon polyps, that is a very different conversation, and your doctor may have a legitimate reason to recommend a colonoscopy even at an older age. This is, again, why personalized medicine matters so much. But if you are over 75, have been screened regularly, and have had clean results, ask your doctor, do I still need a routine colonoscopy? For many seniors, the honest evidence-based answer is no. So now that we've talked about 5 tests that may be doing more harm than good for many seniors, let's talk about what you absolutely should focus on. Because this video is not about avoiding healthcare, it is about smarter healthcare. Here are 5 things every senior over 65 should prioritize. Number 1, blood pressure monitoring. High blood pressure remains one of the leading causes of stroke and heart disease in older adults. Monitor it regularly, at home if possible, simple, non-invasive, genuinely life-saving. Number 2, annual eye exams. Glaucoma, macular degeneration, and cataracts are leading causes of vision loss in seniors, and vision loss dramatically increases fall risk. Do not skip your eye doctor. Number 3, bone density testing. For women over 65 and men over 70, a scan to check for osteoporosis is highly recommended. Falls and fractures are a leading cause of serious decline in elderly adults. This is one screening that absolutely belongs on your list. Number 4, hearing tests. Untreated hearing loss is now linked to accelerated cognitive decline and increased risk of dementia. If you or your loved one is struggling to hear, please get evaluated. This one is deeply important and far too often overlooked. Number 5, medication review every single year. Ask your doctor annually, are all of my current medications still appropriate for my age and health? Many seniors are on medications that were started years, sometimes decades, ago and never reassessed. This one conversation could prevent dangerous drug interactions, reduce side effects, and genuinely transform how you feel day to day. I know that for many seniors, especially those of a generation taught to respect authority and not question their doctor, having these conversations can feel uncomfortable. But here is what I want you to remember. A good doctor wants you to ask questions. A good doctor welcomes your engagement, and any doctor who dismisses your thoughtful, informed concerns does not deserve your trust. Here are 3 simple questions you can bring to your very next appointment. Write these down if you need to. Question 1. Is this test recommended for someone my age by major medical organizations like the U.S. Preventive Services Task Force? Question 2. What happens if the test finds something? What are the next steps, and what are the risks of those steps? Question 3. What are the risks of not doing this test, specifically for me at my age? These are not argumentative questions. These are the questions of a thoughtful, engaged adult who takes their health seriously. Bring them to your appointment. You have every right to ask them. Let's bring it all together. Today we talked about 5 medical tests that many leading doctors and medical organizations now recommend reassessing for older adults. Number 1. PSA testing for prostate cancer in men over 70, where overdetection often leads to harmful treatments for cancers that would never have caused problems. Number 2. Aggressive cholesterol screening and statin treatment in adults over 80, where the risks frequently outweigh the benefits at advanced age. Number 3. Routine. Pap smears for women over 65 with a history of normal results, where continued screening can cause more harm than it prevents. Number 4. Routine cardiac stress testing for seniors without symptoms, where false positives trigger dangerous and unnecessary procedures. Number 5. Routine colonoscopies after age 75 to 80, where the risks of preparation and sedation can outweigh the benefits for those who have been regularly screened. None of this means abandoning your health. It means protecting it more wisely. You have lived a long life. You have earned the right to health care that truly serves you, not a checklist that was never designed with your age in mind. Be curious, be courageous, ask questions, and always advocate for yourself. If this video gave you something valuable today, a question to ask, a conversation to start, or simply a new way of thinking about your health, please hit that like button right now. It helps this information reach more seniors who deserve to hear it. If you haven't subscribed yet, please do. We post new senior health content every single week. Honest, research-backed, and always written with your well-being at heart. Leave a comment below. I want to know, has your doctor ever recommended a test that left you with more questions than answers? Share your experience. You might help someone else feel a little less alone. And please, share this video with the people you love, a parent, a spouse, a neighbor, an older friend, because sometimes the most loving thing we can give someone isn't a gift, it's information. Take care of yourself, and I'll see you in the next one. Outro music fades in, end screen with subscribe button and related video suggestions. Disclaimer to read at start of video. The information in this video is for educational purposes only and does not constitute medical advice. Always consult with your personal physician before making any changes to your healthcare routine.